Everyone, welcome back to our Q&A series, and today's Q&A is going to be about condoms. I am Shakeela Rogers, and I am an intern for BGSU's Wellness Connection, and I have Danielle Van Fleet with me today. Hi, Danielle.
Hi, Shakeela. How you doing today?
Pretty good. How are you?
I'm doing well, thank you. Thanks again for having me and doing these series.
Thank you so much for being here. I really appreciate it. Well, I'm going to go right ahead and get into the questions because I have so many for you today.
Okay.
All right. So the first question that I have is, will condoms make sex less enjoyable?
Well, some people might say that using a condom does make things less enjoyable, but there's also some tricks that you can use to make sex more enjoyable with a condom. And that trick is lube. Lube will change the whole experience of sex, but you have to make sure that you're using a water-based lube with condoms, because if it's a primarily silicone-based lubricant, it'll break the condom down during sex and it will end up popping. So what you need to do is when you take the condom out of the package, just put a couple of drops of lube right on the inside of the condom. Just a couple of drops. Don't go crazy and use too much. And then that will help the condom go on easier and reduce breaking and tearing. And then put more lube on the outside of the condom, and then lube on whatever the port of entry may be, either the vagina or the anus. All that lube seems like a lot of extra work, but it's going to actually act as a heat conductor and pull in heat to whomever's wearing the condom will be able to get heat from the inside of the body. Whenever they're penetrating the anus or the vagina, and it will feel better for the person wearing the condom. And then that lube will also feel better for whoever is receiving, because sometimes during sex, especially anal sex, because the anus doesn't naturally secrete like the vagina does, so it gets dry very fast and can feel all that friction and not as good for the person who is receiving. And then even during vaginal intercourse, even though there is natural lubrication, there can still be some vaginal dryness that might occur with latex, because latex isn't a natural substance that the vagina is used to having inside, so it can get a little bit concerned and wonder what's going on and dry up a little.
So I know you talked about only using water-based lubes. So there are different lubes like heating or cooling. So would you say those are good to use or no?
Those are really good to use for like body play, to kind of use as like more of a body massage kind of foreplay. There can be some additives into those lubes that should not be inside of the body. So just stick to some good old-fashioned KY, Astroglide, any kind of water-based lubricant that you can find in a drugstore or even a local sex toy store. But I wouldn't use any flavored for inside of the body. Flavored lubes are good to put on the condom when you're going to be giving oral sex, so you just don't taste all the latex. And again, for like body play, for like putting it on the body and like licking it off. But I would not recommend to put that inside of the body. There are some sugars in those flavored condoms, and those sugars can cause some infections in the vagina or the anus. So I definitely would guard against using that for penetrative sex. Just use it for body play, and make sure that the packaging for the lube says compatible with latex condoms.
Okay. Well, thank you for clearing that up because I did not know that. Speaking of sugar, who put sugar in lube? That's so weird. So my next question is, it's mostly about like condom sizes. So, there are extra large condoms and all these myths that you might need an extra large condom. So is it true that one size can fit all?
No, one size does not fit all. As a matter of fact, I brought in, I have a whole binder.
Oh, wow.
Different styles of condoms. I know you can't really see them, but I just wanted to be able to show you that there are many different condoms, condom sizes, condom brands. There's not a one size fits all. I would recommend going to the drugstore and just having a look around. I know it might seem a little bit embarrassing, but nobody wants an STI, nobody wants HIV, and not everybody wants a baby. So
Yeah.
and you can tell like this whole binder is just full of different styles of condoms.
Yes.
So there's just like a run-of-the-mill, like the average size condom. There's ribbed and studded. There's large. There's extra large. There's different brands of the large and the extra large. Everybody wants a Magnum.
Yeah.
But everybody needs that gold coin Magnum. As a matter of fact, if you're wearing a condom that doesn't properly fit, if you don't necessarily fit the size of the Magnum and you're using it during sex, it can come off inside of your partner, and then sometimes you have to go to an emergency room or your OBGYN or a doctor, and to have that removed, because if the condom doesn't fit right or isn't on properly, it will just come right off inside of the body, and then you're going to have somebody help to get it out. Sometimes you can get it out on your own, but not always. And people kind of look at me funny when I tell them that it can literally come off inside of the body. But I have had friends and I've had people come through my testing room that have told me that this in fact does happen. It's normal. So that's why understanding what condom fit is best for you is so important, and properly putting the condom on is so important. That way it does not come off inside of the body, and it can cause an infection if you don't know that it's come off, or you're fishing around, or you think maybe it just is in my sheets. And so you really have to be comfortable with the condom that you are using.
Okay. Well, that's good to know, because nobody wants to go to the hospital to get a condom hooked out of them, like put out them.
No, you're like, it's already, people think it's embarrassing to go buy the condoms. Well, it's going to be even more embarrassing to go to a doctor and be like, so I have nuts and
Right.
It shouldn't be an uncomfortable conversation because we're sexual beings burnt to death. But it surely can be an uncomfortable conversation.
Exactly. So I know you talked about STIs and stuff like that. So can using condoms reduce the risk of STI transmission during sex, or any type of sex, anal, vaginal, oral?
For sure it can. If the condom is used properly, it can reduce sexually transmitted infection transmission. Now, herpes is just skin-to-skin contact, so a condom is not going to prevent herpes transmission. So that's why it's important to talk to your partner about if they've ever had a sexually transmitted infection, if they've had herpes, are they medicated, do they have outbreaks? Because just not everybody has outbreaks with herpes, but if they are having an outbreak and it's on their groin area, an area that's not going to be covered by the condom, when it's just, you can just be laying naked and it can transmit. So it's important to have these conversations with your partners about if they've been tested. And I know that it's uncomfortable to have those conversations, but it is also very uncomfortable to get one of these infections.
Absolutely. And I know we've talked before about how important those conversations can be. So I completely understand. So my next question is it true that some people can get infected with STIs in spite using a condom consistently?
Right, that's like when I was talking about the herpes. That's the skin-to-skin contact. Or if you put the condom on and then it doesn't slide on properly, like I have my little demonstrator friend here. So if you put the condom on and it's not sliding on, so you take the condom off and you flip it around and then you put it on and it slides on properly, right? And you think, okay, we're good to go. But you're really not, because when you put the condom on the wrong way and then you flipped it around, there's already pre-cum that's going to be on the outside of the condom. So then when you flip it around to get it on the correct way, then you're going to be exposing the body to the pre-cum, which is going to have sexually transmitted infection in it, and then it's going to go right inside of the body. So it's really important to have like 4 condoms on you. 2 for you in case you make a mistake, and some for your friends.
Got it. Just in case, you never know. So speaking of that, I know you talked about if you flip it around, that can cause you to get in there. Can a condom be used more than once then?
No, a condom should not be used more than once. So the rule of thumb is a new condom for every new sex act. So if you are having vaginal intercourse and then you decide to have anal intercourse, you should change your condom out. And if you're having anal intercourse and going to the vagina, you definitely need to change it out because there's bacteria in the anus that are, once it goes inside of the vagina, that's going to create a really nasty infection in the vagina once those bacteria get inside of the vagina. So our rule of thumb is a new condom with every new sex act.
Okay.
You don't want to reuse a condom because there's to get it when you take the condom off, the likelihood of you getting some of the cum on the outside of the condom, and then it really won't go back on properly because it's already been stretched out. So don't use a condom more than once.
Okay. I always wonder, like, how could you use a condom more than once? It'd be so hard to get it back on, like you said. So
yeah, but I have heard of people that do ask that question. So it must have happened at some point.
Exactly. So with that being said, like, can condoms expire? Do they have expiration dates?
They sure do, because of the lube that's on the condom and because of it being in a packaging, and anything that comes from like a manufacturer has a expiration date. So you really want to make sure that you are paying attention to the expiration date on your condoms. I have my package here of condoms. They're all expired, but they usually don't expire for like 4, maybe 6 years. So I don't know, you probably can't really see, but it will have the expiration date right up here where different condoms have them in different places. So you just want to make sure that like you're just checking your stash, because in the moment, who's going to be like, is my condom expired? Hold on, babe. Right. I got to take a look here. Nobody is doing that. So you want to make sure that you are just ahead of the game, and you know that if your condom is expired or not. And even though like this condom I'm holding right now says it expired in 2018, so you would think, well, that would mean that it might be dry, that because you want to make sure the condom has like the air bubble in it, and it can still squish around. So even though this condom is expired by 2 years, it still has the air bubble and it still squishes around.
Wow.
So don't use it. I mean, it's still, I would not suggest to use it, because you don't know if that lube, the lubricant, the natural lubricant and the condom, not natural lubricant, the lubricant that the manufacturer puts on, that could turn, and then you could get an infection from using it.
Okay. So with that, I know you talked about the air bubbles with the condom. So is that a way to tell if it's expired, or how can you tell if a condom is expired?
Well, just by the expiration date, you can tell if it's expired. But if you can't like squish the condom around, that means that there has been a puncture to it and air's gotten in it and it's dried up. Okay. So you want to be able to make sure that it squishes around and that air bubble is still present. And if it is expired, though, don't use it even if those things, or even if it does still squish around the air bubbles there, don't use it if it's past its expiration date. But even if it's within its expiration date and, you go to squish it and it doesn't squish to the side, that means it's been tampered with in some capacity. That could mean it's been stored improperly. You should never store your condoms in a wallet. Because they can get punctured with credit cards or from sitting on it. Plus, condoms are temperature sensitive, so you can't leave them in your car. This time of year, it is entirely too hot for too hot for humans, let alone latex. Yes. And in the winter, it's going to be way too cold, and they're going to freeze, and they're going to thaw, and that's going to tamper with the condom as well. So you just want to make sure that you're keeping it like in your pocket. There's condom cases that you can get. I don't have any cases on me right now, but there's just little plastic cases that you can get, especially for like the ladies, for keeping it in our purses or in our makeup bags or whatever, because there's all kinds of things that can puncture a condom in our purses. Oh, yes. All kinds of things. So and for guys, just keep them in your pocket. Gotcha. Don't put it in the wallet.
Okay. So I know like the most common condom that everybody knows is like latex. That's like the number one. But are there any other condoms that aren't made from latex?
Sure. So there's polyurethane, there's lambskin, there's other kinds because some folks do have a latex allergy. And so in order to be able to still wear a condom safely, I recommend to use the polyurethane condoms. those are the safest non-latex condom for transmission of STIs.
Okay. So my next question is going to be about female condoms, because I don't think a lot of people know about female condoms. So are female condoms more effective than male condoms?
So I don't call them female and male condoms, just to stay inclusive. We call them internal or external condoms. So I happen to have one of my internal condoms here for a demonstration. And it's not that it's any more or any less effective. It's just the comfort of the person who's going to be inserting it. It can be a little bit more cumbersome, and if somebody is not exactly comfortable with putting something inside of their anus or inside of their vagina, then this isn't for them. Notice I did say anus. This can be put inside of the anus.
Oh, wow.
And I have had folks who have put it in the anus and have used it that way, and it is safe and effective to use it in the anus as well. The nice thing about internal condoms is that you can have them in for multiple hours. So if you know you're going to go out and hook up, you can just put it in and it won't interfere with your night. If you are female and you're putting it in, it won't interfere with urination. Of course, if you're putting it in your anus, it will interfere if you have any sort of bowel movements. But you can put it in for hours. I believe that you can put these in for up to 5 hours.
Wow.
This is also nice for folks who might be exchanging themselves for drugs or money or something that they need. They can put this in and they don't have to worry about asking the person who's paying them if they're going to use a condom. They already can have it already inside of them. So you need to make sure you're using lube with this, and what it is, I don't know if you can see. So there is this little ring on the inside.
Okay.
Do you see that?
Yes.
And it kind of looks like a Nuva ring, like the birth control ring, and that will be inside of the condom. And the condom comes all packaged up like this. And see, here's the packaging.
Okay.
There are directions on the back of the packaging.
Okay.
And you just squeeze this. You squeeze this ring, and you would just slide it inside of yourself if it's going to the vagina or the anus, and then this part would either lie flat against the labia or the anus.
Oh, wow.
And then the penis can just go right inside of there.
Okay.
If you're using this for anal sex, it is recommended for you to slip that ring out, because that ring won't be very comfortable in the anus. But it's fine inside of the vagina. That ring will just end up popping right into place as it needs to. It will end up looking something like this inside.
Oh, wow. That is super cool.
It is cool.
Yeah.
And, it's nice to be able to have something to just put inside of yourself and like take responsibility for safe sex, and not having to have kind of those uncomfortable conversations with somebody else about putting the condom on, or we're going to use a condom, or possibly, giving in. If somebody says, I don't really want to use a condom, you're going to say, fine, I'm just going to put this on.
Exactly.
But at the same time, we need to also advocate for ourselves to, just put the condom on the penis and not feel like it's only the person, who's going to be wearing the condom. It's not just their responsibility to put it on. And as women, I don't feel like we are empowered to learn how to put a condom on our partners.
Absolutely.
And we just believe that guys are born with some condom putter on our gene, and they know what they're doing, and they don't really know much better than we do unless they had really good sexuality health program, or their parents were really open with them. But they don't really know either. Yeah. And so it's okay to teach our girlfriends and our sisters and our nieces how to properly put a condom on, so that we don't get put in those situations where it's like, he says, I don't have one, I don't want to use it, and we say, okay.
Exactly.
It's time for us to stand up for ourselves and say, I have a condom. I know how
Yes.
to use it. Why don't you just lay down and let me do
Exactly.
that? And that's okay.
Yeah. That's a really good point. I agree completely. I agree completely.
You guys have not been taught any more than we have. You know, we've all learned, especially, you know, with the internet. How are we learning about safe sex and, you know, sexually transmitted infections and sexuality? It's all on the internet. And sometimes the internet is not giving us the best information, except for your series that you're putting together.
Exactly. No. Absolutely. But that was a very valid point. I completely agree with everything that you said. Really good points. So next we're going to talk about what causes a condom to burst or slip off during sex, because I know a lot of people have had that issue and they might not know what's causing it. Like it just happens and it's like, what do I do? Like what is causing this?
So it could be for a couple different reasons. It could be because there wasn't enough lubrication and, you know, so it starts to create some sort of friction. It could be that the condom was not put on properly. So if you put the condom, which I'll demonstrate in a second with my little friend here, how to properly put a condom on, so I'll be able to show you. But if you put the condom flush on the head of the penis, and then when he comes, when a man comes, it's equivalent to driving a car about 25 miles an hour. So if you put that condom flush up against the head of the penis, it's going to just blow off inside.
Wow.
So you need to make sure that you're leaving that bubble, which I will demonstrate in a second. So that's, you know, those are some reasons why the condom can break. And it could be that the condom, like I said, wasn't put on properly. So it could have been put on like with somebody could have a hangnail and not even know it, and it snags the condom in the smallest amount. And then during sex, that friction, that small little hole that got in there from the hangnail just gets bigger and bigger and bigger, and then the condom breaks. It could be when they opened up the package, they ripped it open with their teeth, like, you know, like sexy movies do, you know, and everybody wants to be all sexy and rips it off. And that's not helpful because you could actually snag a corner of the condom, and then during sex, it's going to pop.
Yes, yes.
So, you know, you just don't want to do that.
I think condoms are like so delicate and people don't know, you know, but they're very delicate.
Yes. Yes. I really quickly want to touch base on one quick thing that I missed. So I'm going to ask you a question. Do you think that you can use a internal condom and an external condom together?
I'll say yes.
Okay, and a lot of people would say yes because it's double protection, right? And the answer is actually no. And that is because the two latex together, it'll just cause all the friction, and then one of them's going to break.
Oh my gosh. Ooh, and I bet that's very uncomfortable as well.
It could be, but if there's all the lube and everything's going, maybe not. So never, ever, ever use an internal and an external together, and don't use two externals. I've heard of some people say, oh, I'm just going to double bag it.
Yeah.
No, it's just going to, just all the friction, and it's just going to pop, and then we've gotten nowhere. And then people are like, I don't know how I got pregnant. It's like,
we're
going to get the STI.
Yes. So I know you showed like how to put on an internal condom. I believe that's what, yes. So can you demonstrate, like you said, how to put on like an external condom?
Sure. So what you're going to want to do is make sure you push the condom all to one side, and then just take the edge and just gently rip it off, okay? And then pull the condom out, and this might be a little cumbersome for me because my camera won't work right. So then here is our penis. You're just going to, oops, I put it on wrong. I can't slide it down. So what should I do? Can I flip it over and try again?
No, you have to get a new one.
I have to get a new one.
Woo!
Exactly. So
we're learning.
Gotta put it. So now what am I supposed to do first? Well, we've checked the expiration date.
Yes.
And then we're going to push it to the side. We're going to pull it on out. And now we're doing it the correct way. Pinch the tip. And we want to pinch the tip because that's where the cum is going to go. We want to make sure that there's air there, that there's an air bubble there for the cum. And we're not going to slide it down with our nails. We're actually just going to slide it down nice and easy with the pads of our fingers.
Okay.
Making sure we still have that air bubble.
Perfect.
You see that? And then once, see, I don't know if you can see this. See how it's too big on this?
Yes.
So see, like that is a thing. It can be too big, and then that's not good either. And then once he has come, you don't want to just leave this inside of the vagina or the anus because the penis is going to start to go soft. And then once it does that, then that's going to leave some air for the cum to slide right out of the bottom there and then go inside of the body. So pretty shortly after he comes, just go ahead and pull out, slide the condom off, and I always say to knot it just so the cum doesn't spill everywhere. And then we're not going to throw this down the toilet because it can clog up some septic systems. It can clog up the toilet. And then, like, if you're in an apartment or something, then you have to call your landlord, or at home, you gotta tell your parents. And you also don't want to put this in like a waste basket where an animal can get to it because animals do like human scents and they will eat these. And then you have to, now your dog is sick and you have to go to the vet and have it removed. So just wrap it up and throw it away somewhere safe.
Gotcha. Well, thank you for that. That was perfect. Thank you.
You're welcome. Don't put it on with your teeth or your fingers. Just right the pads of your fingers and just slide it on.
Just keep it nice and simple, huh?
Please.
So I know we talked a lot about like before condoms breaking off or slipping and bursting or whatever. So what can men and women do to reduce the risk of pregnancy and STIs if a condom slips or breaks off during sex?
Well, there's Plan B. So if that is available, different drugstores have different rules and regulations. So sometimes Plan B is behind the counter. Sometimes, it's out. Just you can grab it from the pharmacy area. I do know we're currently now, in the pandemic, you can have it shipped to you. You can order one online. And if the condom does break, we do recommend that you get an HIV test and a sexually transmitted infection screen pretty, quickly after, especially if this is a partner that you don't know about their sexual health status.
Absolutely.
And that's always important to make sure that you're getting screened.
Okay. So speaking of getting tested, where can BGSU students go to get tested, or if they end up pregnant, like where can they go for resources and stuff like that?
So I'm going to read a little bit of this because I don't remember this off the top of my head. So you can go to the Wood County Health Department. Their phone number is 419-352-8402. You can go to the Falcon Health Center right on BGSU's campus. They can do an STI screen and an HIV test. There is a fee that will be charged to an insurance plan. And that number is 419-372-2271. Her choice is in BG, and they do chlamydia and gonorrhea testing Mondays only, from 10 to 3 by appointment. And that is 419-345-4673. And then hopefully I will be back on campus doing free HIV testing. And you can contact me through the Wellness Connection or find out when the testing will be available to students free of charge. It's not just students, it's anybody in the BG area can come to the Wellness Connection and get a free HIV test.
Well, hopefully we can get that started soon with everything going on. Fingers crossed. Yes. Well, that was the last question I have for you today. Yeah. Well, I want to thank you so much for taking time to answer these questions. Again, I know you always come and you do such a great job. So I really appreciate it. So you guys can check the links in the description box below for more information, or call or email the Wellness Connection to ask questions. So thank you all again, and we'll see you next time. Bye.
Thanks for having me.
Thanks.